35-year-old woman presents with hand pain. Now, I know it's a hand and not a foot, but they're very similar, and the similar lesions occur in similar locations. So here we are seeing this lucent lesion replacing the fourth metacarpal head and a portion of the neck to the mid-diaphysis. We have this lengthy lesion, and what we don't really see inside of the lesion is any matrix. I'm looking for osteoid, chondroid, fibrous. And I can't be sure there's not fibrous matrix here, but it also could be lucent from a lucent lesion. And drawing from what is most common here, this is an enchondroma in a 35-year-old patient. And when the lesion is as long as this one and occupies the length, they will assess it for curettage and packing. So generally speaking, lesions over 2 centimeters in length will be assessed for curettage and packing. Enchondromas, these are usually solitary lesions in the 20 to 40-year-old age group, but they can be multiple. And especially when patients are younger presenting with enchondromas, you want to think about the multiple diseases such as seen here in Olliers and Maffucci's. These lesions, again, are characterized usually by no periostitis unless, like you see here, there are pathologic fractures. So pathologic fractures will induce a certain amount of periostitis. The location generally are going to be central and intramedullary. 50% of solitary enchondromas are found in the hands and feet. So those are lesions you want to be aware of because you're going to encounter them often in your practice. Spectrum of enchondromas. When we look at cartilage, we can think of cartilage can be stippled. It can be flocculent as they join closer together, and there can be actual rings and arcs. So stippled mineralization, you may not appreciate that there's any kind of stippling inside of the lesion. When they move together, you begin to understand more that this is a chondroid pattern, these small little lobules and nodules. And then, of course, on an MRI, we can see more about the ring and the arc formation, and even some of the septal type of patterns that form together these lace-like septal villus projections.